Hello everyone! Welcome back to my YouTube channel. It's me, Tala P. And for today's podcast, for the Medical Technology series, we are going to deal with bacteriology subject. So before that, if you want to listen to more discussions with the field of medical technology, you can subscribe onto my channel and you can like my videos, and it's a bonus for me if you are going to click on the bell for notifications. So for bacteriology subject for today's podcast, we will be dealing with antimicrobial agents associated with antimicrobial susceptibility testing. So this antimicrobial susceptibility testing, I'm going to upload a separate video for that. So what we are going to deal with are the antibiotics. So what are antibiotics? These are antimicrobial agents. These are any substance that inhibits or kills outright the growth and replication of a bacterium. So basically, these antibiotics, they are medicines for infections caused by bacteria. Examples, the most common antibiotic that we know in the history is the penicillin. And penicillin, we all know that the popular scientist who discovered that antibiotic, it's in pharmacology, that is Alexander Fleming. And you take note that these antibiotics, these are not working against viral infections, so they do not work against viruses. And these antibiotics, they can have a broad or narrow spectrum of activity. So how are we going to differentiate that broad spectrum activity of the bacteria and the antibiotics, and that of the narrow spectrum of antibiotics against the infecting organism? So when we say narrow spectrum, these are some antibiotics, they are highly specialized and are only effective against certain bacteria. On the other hand, that of the broad spectrum activity of antibiotics, they usually attack a wide range of bacteria. They are active against a wider number of bacterial types, and thus they may be used to treat a variety of infectious diseases. So that of the narrow spectrum of activity, for example, they only target gram positive or they can only target gram negative. But that of the broad spectrum activity of antibiotics, they can both target both the gram negative and that of the gram positive bacteria. So that's the difference. And for these antibiotics, by the way, what are the ways in which antibiotics targets the bacteria? So number one is that they prevent the reproduction and they kill the bacteria. How? They can, for example, they will stop the mechanism responsible for building their cell walls. That's why these antibiotics, they have different target sites. So these target sites, it's very important for them to kill and stop the reproduction of this bacterial cell. So what are the target sites of the bacteria of these antibiotics? They can target the cell wall, the protein site, the nucleic acid, such as the RNA and the DNA nucleic acid synthesis, that of the cell membrane or the plasma membrane of that bacterial cell, and also the metabolic pathway. So, what are the different antibiotics that usually targets each of the sites? So there are common examples that I will be showing later on in this PowerPoint. So this is an example of a bacterial cell structure wherein there are listed antibiotics with their specific target sites. So how are you going to memorize all those listed antibiotics with their target sites? So I have some mnemonics that may help you in familiarizing with the specific antibiotics that targets the cell wall, the plasma membrane, the protein site, which is the ribosomes, the 30S and that of the 50S subunits, the metabolic pathways, and the nucleic acid site synthesis, that of the DNA synthesis and RNA synthesis. So let's start. For the antibiotics that usually inhibits the cell wall synthesis, there are four common. That is BGBC. So you just remember be gentle and be caring. So what is that? Be gentle and be caring for the mnemonic on the antibiotics that are the inhibitors of cell wall synthesis. So let's start. Be gentle, and be caring. So that of the letter B, it refers to the beta-lactam groups. The beta-lactam groups. So this beta-lactam group, if you heard of this type of antibiotics, the examples are penicillin, cephalosporin, monobactams, and that of the carbapenems. And that of the letter G, gentle, it refers to glycopeptides. These are the glycopeptide group. And an example of that is the vancomycin. For the glycopeptide group, we have that vancomycin. And B, that is for bacitracin. And letter C, that is for cycloserine. Okay, so you remember be gentle and be caring. B, that is for beta-lactam groups, which includes penicillin, cephalosporin, monobactams, and carbapenems. That of the letter G, that is for the glycopeptide group. An example for that is the vancomycin drug. And that of the B, it refers to bacitracin. And lastly, letter C, that is cycloserine. So I can give examples of the mechanism of action of each of the drugs, some. So that of the letter B, we start with the beta-lactams. So the most common in the beta-lactam groups is the drug penicillin. So penicillin, usually in the history, it's the first antibiotic discovered by Alexander Fleming, and it's one of the general antibacterials within the class beta-lactams. So if you heard of penicillin G, and there is also penicillin V, so what's the difference? That of the penicillin G, it's like the older penicillin, and it's a natural antibiotics coming from fungi. And that of the penicillin V, it is primarily active against gram-positive bacterial pathogens and a few gram-negative bacteria such as Pasteurella multocida. So when you are going to classify whether this penicillin V has a broad spectrum or narrow spectrum of activity, since it only is active, primarily active against gram-positive and a few gram-negative only, then it has a narrow spectrum of activity. And if you want to increase the spectrum of activity of this penicillin against more gram-negative pathogens, that of the penicillin can be combined with amino group. So like for example, penicillin G plus amino group, then you can derive with the product aminopenicillin. And examples of aminopenicillin, we have this ampicillin and that of the amoxicillin. So if we have this penicillin G and plus amino group, we will be deriving with the product aminopenicillin. And the most common example of aminopenicillins are ampicillin and amoxicillin. So this can increase the spectrum of activity against more gram-negative pathogens, not only for Pasteurella multocida, but other gram-negative pathogens. So that is penicillin. And another example of beta-lactam group, we have this cephalosporin. So what are cephalosporins? Example, we have the cephalosporin C. That of the cephalosporin C, they are originally isolated from the fungus known as Cephalosporium acremonium. So cephalosporin C, they originally isolated from the fungus known as the Cephalosporium acremonium. Again, it's Cephalosporium acremonium. And this cephalosporin C, they have a similar spectrum of activity to that of the penicillin against gram-positive bacteria, but is more on gram-negative bacteria than penicillin. So again, the cephalosporin C, they are active more on against gram-negative bacteria. Unlike that of the penicillin, they are more active on gram-positive bacteria. But there's a new fifth generation cephalosporin that is developed that is active against MRSA. So again, there is this type of cephalosporin. It's a new fifth generation cephalosporin wherein it's active against a specific organism, and that is for Staphylococcus aureus causing MRSA. So when we say MRSA, when you transcribe MRSA, it means methicillin resistant is Staphylococcus aureus. So the penicillin drug, I mean the cephalosporin type that is active against MRSA is the new fifth generation cephalosporin. Okay. Another example of beta-lactam group, we have this monobactams. So monobactams, and the carbapenems. Example of that of the monobactam, the only monobactam used clinically is aztreonam. Again, the only monobactam that is used clinically, that is aztreonam. And this aztreonam, it has a narrow spectrum of activity or narrow spectrum antibacterial with activity only against gram-negative bacteria. So that aztreonam, an example of monobactam, it is active against only gram-negative pathogenic organisms. And lastly, for that of the beta-lactam groups, we have this carbapenems. Carbapenems. They usually includes a variety of semi-synthetic drugs such as imipenem, meropenem, doripenem. So those are examples of the semi-synthetic drugs of the antibiotic carbapenems, imipenem, meropenem, and that of the doripenem. So these carbapenem drugs, they has a broad spectrum activity against both gram-positive and gram-negative organisms. So again, for the beta-lactam groups, we have examples of penicillin, cephalosporin, monobactams, and carbapenems. And that of the letter G here, for the letter G, it includes the glycopeptide group. So an example of a glycopeptide group, we have the vancomycin. So if you heard of this drug, they are actually a natural antibiotic from the from Actinomycetes amycolaptosis orientalis. So that of the cephalosporin C, again, originally isolated from the fungus Cephalosporium acremonium. What about that of the vancomycin under the glycopeptide group? So this vancomycin, they are a natural antibiotic from Actinomycetes Amycolaptosis orientalis. So the subspecies is orientalis and that of the species is Amycolaptosis, and the genus is Actinomycetes. So when you combine, it's Actinomycetes Amycolaptosis orientalis. And they are active against gram-positive, this vancomycin, but not on gram-negative bacteria. And the most common gram-positive organism wherein this vancomycin is used as the drug of choice for treating this organism is Clostridium difficile, and also it's active for Staphylococcus aureus causing MRSA, that of the methicillin-resistant Staphylococcus aureus. So if you remember, there are two antibiotics that are actually active against methicillin-resistant Staphylococcus aureus, and those are the new fifth generation cephalosporin and the vancomycin. Okay, and another we have here the bacitracin. They are usually effective against gram-positive organism, especially those gram-positives that are found on the skin, such as, what do you think? What are the bacteria that are usually found in the skin? So that is Staphylococcus, and it can also be Streptococcus. So this type of drug, they are effective against gram-positive organism, usually found on the skin surfaces, such as that of the Staphylococcus and Streptococcus. And this bacitracin, they can be orally or intramuscularly be administered, but they are nephrotoxic. And for since they are toxic when they are given orally and intramuscularly, it can be combined with neomycin and polymyxin, so that you can use topical ointments. And these topical ointments with this bacitracin plus polymyxin, or a combination of bacitracin or neomycin, you can have the topical ointment Neosporin. Okay, Neosporin, since the administration for oral and muscular injections can be nephrotoxic, then since this drug, they are active on bacterial infections in the skin, then they can use topical ointments such as the combination of bacitracin plus polymyxin or bacitracin plus neomycin topical ointment known as Neosporin. And lastly, we have the cycloserine. So let's have a recap. Be gentle and be caring. That is for beta-lactam groups, glycopeptides, bacitracin, and cycloserine. Okay, so the next one, what are the inhibitors of protein site synthesis? So what are the different antibiotics under this target site? So usually, these are the most common examples of antibiotics that targets the protein site synthesis, the ribosomes, that of the 50S and that of the 30S subunits. So you remember fat, energetic, chubby cat. Okay, it's the fat, energetic, chubby cat. So before that, that of the erythromycin, that of the by the way, so this fat cat, that of the fat, energetic, chubby cat, it includes letter F, that is fusidic acid, letter E, that is for erythromycin, clindamycin, chloramphenicol, aminoglycosides, and tetracycline. So again, fat, energetic, chubby cat. It includes fusidic acid. And under the macrolide groups, we have here the two macrolide group, erythromycin and clindamycin. We also have chloramphenicol, aminoglycosides, and lastly, tetracycline. Okay. So we start with this erythromycin and that of the clindamycin. First, we have here the erythromycin. Erythromycin, they are derived from Streptomyces erythraeus. So again, this type of antibiotic, erythromycin, is under the macrolide group, and they are deriving from Streptomyces erythraeus. So this erythromycin, they can treat infections of the respiratory tract, including bronchitis, pneumonia. If you heard of Legionnaire's disease, it's a type of lung disease caused by Legionella pneumophilia. And another, they can treat infections caused by Bordetella pertussis. That is the causative agent for the condition pertussis, or we call it as whooping cough, diphtheria. Another is they can also treat infections of sexually transmitted diseases, including syphilis, ear infections, urinary tract infections, and also skin infections. So they can treat a wide variety of infections. That's why you can classify them in their spectrum of activity as broad spectrum. And also with that of the clindamycin, they are used to treat serious infections caused by anaerobic bacteria. So this erythromycin and that of the clindamycin, they are the under the macrolide groups. There are also semi-synthetic macrolides aside from that of the erythromycin and clindamycin, which is the most common. Semi-synthetic macrolides may include azithromycin and telithromycin. Again, semi-synthetic macrolides includes azithromycin and telithromycin. Okay, the next one is chloramphenicol. Chloramphenicol, they are derived from Streptomyces venezuelae. Okay, so that of the erythromycin, recap, that is derived from Streptomyces erythraeus. And that of the chloramphenicol, it is derived from Streptomyces venezuelae. Okay, Streptomyces venezuelae. And actually, this chloramphenicol, it's the first broad spectrum antibiotic that was approved by FDA, the Food and Drug Administration. And this chloramphenicol, they also treat wide range of infections such as meningitis, typhoid fever, and conjunctivitis. But there is a serious side effect that can be associated with this chloramphenicol drug. It can be causing serious side effects such as lethal gray baby syndrome. When we say lethal baby syndrome, it's a type of circulatory collapse that occur in usually premature and newborn infants, and they can be associated with excessively high serum levels of chloramphenicol. That is lethal gray baby syndrome. Not only that, but they can have a serious effect on the bone marrow, suppression of the bone marrow, and that is aplastic anemia. So what specific type of anemia they are associated with? That of the chloramphenicol, they can be associated with aplastic anemia wherein they can suppress the bone marrow. And another we have here aminoglycosides. So there are numerous examples under this group, aminoglycoside group. You remember GTX, GTKS, those are GTX, GTKS, gentamicin, tobramycin, kanamycin, and streptomycin. You also add neomycin for that. So gentamicin, tobramycin, kanamycin, streptomycin, and neomycin. So this aminoglycoside group, they are a potent antibacterial agents. So they have a potent broad spectrum of activity against bacteria, but they can also be nephrotoxic, they can be neurotoxic or autotoxic. Not only this type of drug, but if they are used excessively or they are taken excessively, these drugs, they can have serious side effects also. So they must be they must be taken moderately or with the advice of the physician. And the last one, it's tetracycline. The letter T here, it's tetracycline. So naturally occurring tetracycline, they are also produced by streptomyces. And there are semi-synthetic examples of this drug. Examples are doxycycline. The other one is tigecycline. So semi-synthetic tetracycline drugs includes doxycycline and that of the tigecycline. What is the unique side effect of this type of drug? They can be phototoxic, and there can be a permanent discoloration of the developing teeth of the children, and it can have a hepatotoxic effect or liver toxic effect. So that is tetracycline. So you remember for the antibiotics that are the inhibitors of protein site. So both for the ribosomal subunits that can be divided into two, the 50S subunits and that of the 30S subunits. So we have here fusidic acid, erythromycin, clindamycin, chloramphenicol, aminoglycoside, and tetracycline. So this erythromycin and chloramphenicol, they are under the macrolide group, and that of the aminoglycosides examples are the gentamicin, the tobramycin, the kanamycin, and that of the streptomycin, and also neomycin. So that of the erythromycin and that of the clindamycin and also chloramphenicol, they usually target the 50S subunit of the ribosome, and the remaining two, which are the aminoglycosides and tetracycline, they targets the 30S subunits of the ribosomes. Okay, so those are the antibiotics for the protein site. And the next one, there are antibiotics that targets the nucleic acid site. So it can either be the DNA, deoxyribonucleic acid site, and the other one is the ribonucleic acid site. So you remember this mnemonic, Queen of Rome. Rome, because the letter M here, it's me. It starts with me. Queen of Rome. So what are those antibiotics with this mnemonic, Queen of Rome? Starting with letter Q, these are the quinolone groups, and quinolone groups, they usually targets the DNA synthesis. And letter R here, we have the rifampin or the rifampicin that usually targets the RNA synthesis. And additional to that, we have the metronidazole. Metronidazole, Queen of Rome, quinolone, rifampicin or rifampin, and metronidazole. So starting with the quinolone group, or the fluoroquinolones. Fluoroquinolones, the most common examples, ciprofloxacin, and the other one is levofloxacin. So these two examples of the quinolone group, quinolone drugs, the ciprofloxacin and the levofloxacin, they used to treat serious infections or infections caused by susceptible organisms, such as they can treat urinary tract infections, gonorrheal urethritis, and cervicitis. Others are gastroenteritis and bronchial infections. So these two, that of the ciprofloxacin and levofloxacin under the fluoroquinolone group, they have a broad spectrum of activity against gram-positive and gram-negative organism, because they can treat a wide variety of diseases or infections such as UTI, respiratory infections, abdominal infections, and or skin infections. And letter R here, it refers to the rifampin or the rifampicin drug. And this rifampin, it is used to treat the popular condition known as the tuberculosis, pulmonary tuberculosis. Other drugs that treats this kind of condition, that of the tuberculosis, we have the mnemonic RIPES. So RIPES, RIPES. So R, that is obviously rifampin or rifampicin. And another is letter I, isoniazid or the capital INH or the isoniazid. That of the P, it's pyrazinamide. Letter E is for ethambutol and letter S is for streptomycin. So those drugs, the RIPES, they are the primary primary drugs for treating what kind of infection? That is tuberculosis. And additional to that, that of the rifampin, which targets the RNA site, they can also use to treat people who carry Neisseria meningitidis bacteria but have no symptoms of the disease. Again, rifampin, they are also used to treat people who carry Neisseria meningitidis bacteria but no symptoms of the disease. And lastly, letter M, Queen of Rome. To complete the Queen of Rome, it's metronidazole. And metronidazole, it can treat bacterial vaginosis, it can treat pelvic inflammatory disease, and it is also used to treat skin infections, rosacea, and mouth infections, including infected gums and dental abscess. And it is also an example of anti-protozoan drug. Okay, so again, for the Queen of Rome, it's the quinolone group, that of the ciprofloxacin and levofloxacin. Letter R, that is for rifampin or rifampicin. And lastly, the M, it's metronidazole. Okay, so what about those antibiotics that are the inhibitors of cell membrane function? So you remember the mnemonic, Pretty Little Angel, that is for PLA, Pretty Little Angel. So what are this letter P, L, and A stands for? That of the P, it refers to the polymyxins. Letter L, that is for the lipopeptide group. Example is the daptomycin. And lastly are the antifungals, such as the colistin. Okay, so for the polymyxins, its examples, the product of polymyxin B and polymyxin E, which refers to the colistin. And this polymyxin B, they has rapid in vitro bactericidal activity against major MDR gram-negative bacteria. When we say MDR, these are the multiple drug-resistant pathogens. The gram-negative bacteria such as the Pseudomonas aeruginosa, Acinetobacter baumannii, and Klebsiella pneumoniae. So that polymyxin B, they have in vitro bactericidal activity against major MDR pathogens or the multiple drug-resistant pathogens, gram-negative bacteria such as the Pseudomonas aeruginosa, Acinetobacter baumannii, and Klebsiella pneumoniae. And that of the polymyxin E, aka colistin, they have been used clinically and over the counter. They can be a topical antibiotic ointment, like what we have discussed a while. That is bacitracin plus neomycin, so that is neosporin. So it's a topical ointment. And lipopeptide, example is the daptomycin. It is used to treat bacterial infections of the skin, the underlying tissues and infections that have entered the bloodstream. A good example for this is the MRSA. So methicillin-resistant Staphylococcus aureus, there are numerous drugs that can treat this kind of condition. So if you can remember that of the new fifth generation cephalosporin and that of the vancomycin, plus additional to that is the daptomycin. So this daptomycin, they are also used to treat MRSA or the methicillin-resistant Staphylococcus aureus, or we call this MRSA as the super bug infection. And the last his and additional to that, that of the polymyxin, historically they are used only for bowel decontamination to prevent infections originating from bowel microorganisms. So again, for the antibiotics inhibiting the cell membrane function of the bacterial cell is the pretty little angel, polymyxin, that of the lipopeptide, and the antifungals. And lastly, the metabolic pathway. So what are the antibiotics that are the inhibitors of the metabolic pathways? So we have here the mnemonic simply SIT. So that is for sulfonamides, that is for isoniazid, and trimethoprim. Actually, these sulfonamides and this trimethoprim, they are actually partner to each other, because these sulfonamides, example of commonly prescribed sulfonamides includes the Bactrim, the drug Bactrim, which is actually composed of trimethoprim and sulfamethoxazole. So always that trimethoprim, it is in combination with sulfamethoxazole. And another prescribed sulfonamides is the sulfadiazine. So we have that Bactrim, which is composed of the trimethoprim and sulfamethoxazole, and also the other prescribed sulfonamide is the sulfadiazine. And take note that the sulfonamides, they are the oldest synthetic antimicrobial agents, but usually not commonly used today. And it's an analog of PABA, or the para-aminobenzoic acid. And this sulfonamide, especially that of the trimethoprim, used with sulfamethoxazole, it is used to treat infections such as the urinary tract infection, ear infection, and that of the bronchitis. And that of the letter I here, it refers to an tuberculosis drug, and that is included in the ripes. If you can remember the mnemonic ripes, that is the isoniazid, or the capital INH. When we say INH, it means isonicotinic acid hydrazide. Isonicotinic acid hydrazide. And it's a drug for treating patients with tuberculosis. Okay, so that's all for the list of the drugs that targets those different sites. And additional to that, for this topic, there are antimicrobial terminologies that you may encounter. So these are the following: narrow spectrum versus that of the broad spectrum. So again, when we differentiate these two, when we say narrow spectrum, this type of antibiotics, they are active against a selective group of bacterial types only, and they target few types of bacteria, in simple words. And that of the broad spectrum, it's active against a wider number of bacterial types, and thus they may be used to treat a variety of infectious diseases. So in other words, these broad spectrum antibiotics, they target many types of bacteria. So that's the difference between a narrow spectrum antibiotic versus broad spectrum antibiotics. What about this terminology, selective toxicity? If you hear this terminology for the antibiotics, it's an important quality for an antimicrobial drug, that is selective toxicity. Meaning, when we say selective toxicity, this kills or inhibits the growth of microbial targets while they cause minimal or no harm to the host. And that of the bactericidal versus bacteriostatic action. Simply, when we say bactericidal antibiotics, they kill the bacteria. And that of the bacteriostatic antibiotics, it means that the agent prevents the growth of bacteria. It keeps them in the stationary phase of the growth of the bacteria. It only stops the bacterial growth, but it does not kill the bacterial cells. So bactericidal, there is killing, and bacteriostatic, there is prevention on the reproduction and the growth of the bacteria. And lastly, we have here the drug combination. We are referring to the synergism and the antagonism activities of antibiotics. So when we say synergism, it's when for example, when you get greater effect by combining two or more organisms or components together than you would get by adding the effects of each. And that of the antagonism, it's like when a drug hinders the effect of another drug. Like in mathematical equation, for example, that of the synergism, 1 plus 1 will become 3, and that of that antagonism, 1 plus 1 will become 1, because it decreases the activity of the other. So those are the examples of antimicrobial terminologies in relation to the different antimicrobial agents. So thank you for listening, and I hope you have learned something from this video, and don't forget to subscribe for more upcoming videos regarding the medical technology series under educational category. And please also like my video, and please share it to your friends who may be needing this type of video. Thank you and have a good day.